This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
In the early 1900s, two federal laws were passed on which our current drug regulations are based. The 1906 Pure Food and Drug Act requires accurate labeling. A company wishing to market a new drug must first test it on animals, then file an IND. After a 3-phase sequence of human testing, the company can file the NDA. The 1914 Harrison Act regulated the sale of opioids and cocaine. The Harrison Act was a tax law, but after 1919, it was enforced by a prohibition against providing drugs to dependent users. As drugs became more scarce and their price rose on the illicit market grew. Harsher penalties and increased enforcement efforts, which were the primary strategies of Commissioner of Narcotics. Pot use was added to the list of controlled drugs in 1937, and in 1965, amphetamines, barbiturates, and hallucinogens were also brought under federal control. The Controlled Substances Act of 1970 first provided for direct federal regulation of drugs, not through the pretense of taxing their sale. Controlled substances are placed on one of 5 schedules, dependent on medical use and dependence potential. Amendments in 1988 were aiming at increasing pressure on users, as well as on criminal organizations and money laundering. Federal support for drug screening began in the military and has since spread to other federal agencies. Current federal enforcement efforts involve thousands of federal employees and includes activities in other countries, along our borders, and within the United States. Most states have adopted some version of the DEA's recommended Uniform Controlled Substances Act. Illicit drug trades remain a big business even if most people avoid these substances. The United Nations estimates that only about 5% of the world's population uses illicit drugs, yet that amounts to about 250 million people and a total market value in the hundreds of billions of dollars.